Hello, I am Catherine Whitcap. I'm an OBGYN and preventive medicine physician. I served in the U.S. Air Force for 22 years and continue to see patients in the Washington, D.C. area, primarily those serving in the military, their family members, and retirees. I alone am responsible for the content of this presentation, and it should not be construed as the position or policy of any other entity. The coronavirus pandemic has led to a number of challenges in access to effective contraception for women. Stay-at-home orders in many states and reduced routine outpatient services in healthcare facilities make it difficult for women to access the full range of contraceptives. Almost half of all pregnancies in the U.S. are unintended, and lack of or incorrect use of contraception account for a large percentage of these pregnancies. Although recent years have seen reductions in unintended pregnancies among some subgroups, access to contraception remains a problem, and the pandemic makes it even more difficult for women to obtain the method they need. As you can see, the WPSI recommends that adolescent and adult women have access to the full range of female-controlled contraceptives to prevent unintended pregnancy and improve birth outcomes. Contraceptive care should include counseling, initiation of use, and follow-up care, such as management and evaluation, as well as changes to and removal or discontinuation of the contraceptive method. The full range of methods for women currently identified by the FDA includes sterilization surgery, implantable rods, copper and progestin IUDs, the shot, the pill, the patch, vaginal rings, diaphragms, sponges, caps, female condoms, spermicides, and emergency contraception. Additionally, instruction in fertility awareness-based methods, including the lactation amenorrhea method, although less effective, should be provided for women desiring an alternative method. The WPSI recommends accommodation of an alternative form of contraception when a particular drug or device is medically inappropriate for a patient, as determined by the individual's healthcare provider. Although the coronavirus pandemic has disrupted clinical care, contraceptive services can and should continue. I recommend working with the administrative and care team within your practice to establish procedures to schedule and carry out virtual and in-person visits as indicated. Making women aware that virtual contraceptive counseling is available and providing straightforward instructions for setting up their telehealth visit is an important first step in your practice. Ideally, women would first be scheduled for a timely telehealth visit. Many methods, including the pill, the patch, and ring, as well as emergency contraception, can all be ordered for a patient without an in-person visit or physical exam. For women who choose a method that requires an in-person visit, having a virtual visit prior to the procedure can also serve several purposes. First, it ensures that the patient selects a method that works best for her without the time constraints of an in-person visit. Second, it can optimize the scheduling of the procedure to a time that the clinician can be certain the patient is not pregnant. Finally, it reduces the length of time of the actual in-person visit, thus decreasing exposure time for both the patient and the clinical team. The telehealth visit should be coded in the same way as in-person contraceptive counseling visits, following local guidance from your practice or institution. The procedure can then be coded once the patient comes in person to the clinic. I'd like to share some thoughts about contraceptive counseling, especially in this difficult time when women may be particularly vulnerable and unintended pregnancy could have more significant consequences. I consider shared decision-making as the ideal approach to contraceptive decision-making because a patient's preferences and values are considered in addition to the scientific evidence about a particular method, and the decision is made jointly by the provider and patient. A patient may place particular value on certain characteristics of the method, whether effectiveness, how it's used, how long it lasts, side effects, and non-contraceptive benefits. Her individual preferences within each of these areas will likely help narrow her decision to one or two methods, and shared decision-making can then proceed with the likely outcome that your patient will be more confident in her decision and is likely to be more satisfied with and continue the method she chooses. Decision aids are tools that the patients can complete before or during a visit that can help them clarify values and preferences in preparation for shared decision-making. In my practice, I use a decision aid called Decide and Be Ready that is available free of charge through the App Store or Google Play. It has features for service women, but is applicable and can be used by anyone. After several informational modules, the patient answers a series of questions on the app. The first few questions are demonstrated here. After the patient answers the questions, the algorithm built into the app provides her with a summary of the methods that best meet her preferences and values. This app does not replace a visit with a provider, but facilitates shared decision-making. Contraceptives should be made available for all women, especially during this uncertain time. We should capitalize on the opportunity to make contraceptive counseling even more accessible and effective by offering virtual visits and digital tools, followed by timely procedures as indicated. There are multiple resources available to help ensure women have access to the contraceptives they need. Listed here are only some of those resources. Thank you.